The split brain. The corpus callosum connects the two hemispheres of the brain. One function is to transfer learned information from one hemisphere to the other. Each hemisphere of the brain can function independently when cut. Epilepsy is a severe disorder characterized by chronic seizures. It was known that the seizure begins in one section of the brain and spread. Seizures can range from unnoticeable to debilitating seizures where the victim threatens their own life. The idea to cut the corpus callosum was based on the idea that if the seizure was unable to spread between the two hemispheres of the brain, the victim would be able to keep control of at least half of their body. The split brain patients refer to individuals who have had their corpus callosum cut. The immediate effects of this surgery were significant. Most patients suffered from a reduced amount of seizures or altogether, or had a great decrease in the severity of the seizures, all while the patient suffered from no noticeable side effects. Temporal discrimination in the split brain. Without a corpus callosum, the brain is unable to communicate between the left and the right hemisphere. Therefore, when a visual stimulus is present for the left hemisphere, the right hemisphere is unaware of its presence. Normally, the eyes adjust to each stimulus so that it is present in both hemispheres, but different experiments show what happens without the corpus callosum. An experiment was done in 2003 showing split brain patients an image of two circles on a computer for a certain amount of time while the patient focused on the center. It showed that the amount of time the patient had to see the circles in their peripheral vision influenced their ability for both hemispheres to identify that there were multiple circles. The second experiment focused on their ability to see both circles depending on the spacing between the eyes.